Let's talk about the Portocaval Anastomoses. One of the first things that we have to know about the portal hepatic system is that the blood coming from our dry organs are first going to travel to the liver before going to the heart. And the significance of this is that there is going to be harmful metabolites that are found in the blood coming from our dry organs, and so it needs to reach the liver so that liver can detoxify these harmful metabolites before that blood reaches the heart. And so this is why it is crucial for our liver to function appropriately so that it can detoxify these harmful metabolites. Now, what is the portal system and the caval system? The portal system refers to all the veins that are going to travel to our portal hepatic vein, either directly or indirectly. And the caval system refers to all the veins that are going to either directly or indirectly travel to our inferior vena cava and our superior vena cava before it reaches the heart. Now, there are going to be 4 sites of anastomosis between the portal system and the caval system. And it is very important to know that in a normal, healthy person, there is going to be minimal or no blood flow between these two systems. So in a normal, healthy person, there is either going to be no blood flow or minimal blood flow between the portal system and the caval system. Now, in portal hypertension, this is going to change. There's going to be a buildup of blood in our portal system, and then that buildup of blood is going to flow to our caval system, where it is going to result in different pathologies. And I'm going to talk about those pathologies in the video portal hypertension. But first, let's talk about the anastomosis between the portal system and the caval system. The first region that we're going to look at is the anastomosis of the esophageal veins, which are located here. And we're going to see the anastomosis of the left gastric vein of the portal system with the azygos vein of the caval system. So let's write this down. In this region, we're going to see the anastomosis of left gastric vein, which is part of our portal system, with the azygos vein, which is located in our caval system. Alright, and the second region that we're going to look at is the anastomosis of the umbilical veins, which is located right there. And in this region, we're going to see the anastomosis of the umbilical veins that are found in our portal system with the superior and inferior epigastric veins of our caval system. Let's write this down again. Anastomosis of umbilical veins this is found in our portal system with superior and inferior epigastric veins of our caval system. Alright, now the third region that we're going to talk about is found in our colon. Alright, and this is going to be the site of the anastomosis of our colonic veins, which are part of our portal system, with the retroperitoneal veins of our caval system. And let's write this down again. So the anastomosis, at this site we see the anastomosis of colonic veins that are part of our portal system with the retroperitoneal veins of our Kowal system. And finally, we're going to take a look at the rectum, which is our fourth and final site of our anastomosis. And at this site, we see the anastomosis between our superior rectal vein, which is part of our portal system, with the inferior and middle rectal vein of our Kowal system. Let's write this down again. So at this site, we see the anastomosis. Let me erase this arrow so it does not confuse anyone. So at this site, we see the anastomosis between the superior rectal vein, and this is part of our portal system, with the middle and lower rectal vein of our Kowal system. Okay, and we said that with portal hypertension, at the site of these anastomosis, we are going to see different pathologies. So for example, at site number 1 with portal hypertension, we're going to see esophageal varices. At site number 2, at the anastomosis of the umbilical veins, we're going to see something called caput medusae, which is the dilation of blood vessels. And we're going to visibly see this in patients in their abdomen. At site number 3, we see the anastomosis of colonic veins, and with portal hypertension, this is going to lead to colonic varices as well as retroperitoneal bleeding. And at site number 4, we see the anastomosis of our rectal veins, and with portal hypertension at this site, we're going to see rectal varices as well as hemorrhoids in patients. And we're going to go into more detail with these pathologies in the video titled Portal Hypertension, and we're also going to see pictures associated with these pathologies. See you in the next video.